I hope slides are visible.
Yes, sir, it's visible.
Okay. So, thanks, Rupesh sir. You have covered the basic, the core requirement. Who can be the ideal person to take a community medicine? The attributes or the characteristics of a person to take a community medicine, that nicely explained. And the flexibility, the switching over from one discipline to another discipline, or to change the role also, it's very unique to the community medicine. That is also very well explained here. Now students must be thinking what kind of opportunities are there after taking the community medicine. That I would like to cover here in this my first part of the presentation. So why we need to choose as a community medicine as our post graduation or as our career? So for example, the Rupesh sir already explained that the different opportunities or different roles we can acquire, and those roles can be named as, first of all, the academician. As of now, the most of the students who are post-graduated, they have taken the role as an academician. But because before the COVID-19 pandemic era, the other opportunities were there but not explored, and it was not in the demand. But right now, the proportion of non-academic job will also in increasing way. So I expect that in the near future, the students also will opt for non-academic jobs also. But as of now, the academician is the most commonly opted opportunities from the community medicine postgraduates. Another role we can have is public health expert or epidemiologist. We could be called as a researcher, a consultant, like WHO and UNICEF appoint us as a consultant for various national health programs. We can run our own clinic also as a community physician, and my juniors are doing wonder in community as a community physician. They are running their own clinic. We can be called as a scientist because ICMR appoints us as a scientist. Scientist B to C to ultimately as a scientist G. Or additionally, we can have some occupational health related some course in addition to MD community medicine. Then we can work as a factory medical officer or occupational safety officer in the various industries like Reliance or Tata or whatever it is. Then we can work for government as a program officer for a different program, like state program officer for TB, state program officer for malaria, like this. And someone wants to work as an administrative post, they can go into the system by in the ladder pattern from they can have to go through the MO pathway. They need to take as a MO or block medical officer, then they can go up to the CDHO. But that is a pathway, it's very unique pathway, but it takes some time to reach at the CDHO. So these are the opportunities or role in short we can have, and this is the branch only can have such different types of role which we can perform. Otherwise, if you are MD in medicine, then you are only the physician, or if you are MS in surgery, then you are only the surgeon. But the branch which are having multiple roles which we can perform based on our wish, based on our circumstances, based on our availability and opportunities. So this is the very unique. And who can give us those roles? Let's first talk about the academician. So many of you thinking that the academic jobs are very limited and we cannot have absorbed all of us in the medical institutions. But the good thing is government already realized that the need of the doctor is too high in our country. That's why they have targeted to have at least one medical college in each district. So there are 157 medical colleges are in the pipeline. Either they are under the construction, they are in the approval mode, or they are very near to work as a working institute, right? So there are multiple opportunities are will be available in the near future as a assistant professor or senior resident or more than that. Second job opportunity which we can have from the WHO. WHO is definitely the first UN agency that is offering the job to us in the form of surveillance medical officer. That was the first institute which we already looked for our specific job for the MD-PSM. But now WHO has already increased their basket in the form of TB consultant, IHIP consultant, RCH related posts are there from WHO. UNICEF is also giving us opportunity to work as a health consultant or child health specialist or immunization consultant. So lots of opportunities are also from the UNICEF also. Other UN agency and other international NGOs like JIPMER or CARE Foundation, Merit and Gates Foundation are also giving good opportunities. And the beauty of all these jobs is they require very minimum experience after the post graduation, because they are counting our PG as our experience. So even after 1 or 2 years of experience after the PG, you can be taken as a consultant for WHO or UNICEF or even any UN agency. So that is very good, and they are giving you very good amount of salary. National programs are also giving us lots of posts as NHM consultant, RCH consultant, or immunization consultant. They are also giving us good salary. Occupational health safety officer is very also upcoming avenue for the jobs, because the safety measures are now being stricter, and that's why they are appointing us. And there are lots of things to be done in occupational health, so we can take up research, clinical work, and lots of things in there. NGOs are also always there to give us opportunity, but sometimes salary could be the constraint for opting for the NGO. Own clinic will be always available to us, because we are definitely doctor by heart, so we can work our as our own clinicians, but definitely we need some clinical aspect also added to our experience. But being a community postgraduate, we have some advantage also. Communication skills are there, some national programs guidelines we also learn, some exposure in direct TC or TC, and in our OPD also we have some exposure, so we can definitely able to run our own clinic. Pharma companies also appoint us to make some research work in their trials, and they are also giving us good salary. And we can also work as a faculty in a non medical institutes, like our other training institutes, other public health institutes which are not linked with medical college. We can also be appointed as a faculty in those institutes. Now question comes in students' minds when we are talking about opportunities, like we have opportunity in WHO, we have opportunity in UNICEF or other UN agency. The question comes in students' mind is, would we be able to learn to perform our jobs and duties there in WHO or UNICEF after post graduation? Means they will be asking for any extra skills or anything like specific for that jobs. So to counter that problem, I have summarized some basic things about those posts. For example, WHO is appointing you as a surveillance medical officer. As of now, in particular in the last advertisement, they are giving you starting salary 1.4 lakh, and it requires only MD PSM, no experience required for MD PSM, and you have to work to facilitate acute flaccid paralysis surveillance for polio related outbreak. It is like polio vaccine-related outbreak, or any surveillance related activities, or other immunization related activities like vector disease surveillance. Like this, you need to work on it, and you must be able to do some regular analysis of data, interpretation, and you need to be good at the making presentation and some report writing. So these are the basic requirements to be working as a SMO for the WHO. Where we can have idea where when they are recruiting, there is a link which is given here. There is a link you can enroll yourself for future jobs. And WHO, along with this, there are multiple options are there for us for a job opportunity like TB consultant, and IHIP. Same for ICMR. ICMR is the unique institute, because if you are working as an assistant professor in medical college, for example, 5 years after your post graduation, and now you feel that you are not okay with this comfortable job and you want to explore yourself, then you can join ICMR, because ICMR takes that experience of your academic institute also in their recruitment. For example, if you have worked as 5 years, then you will be appointed not scientist B, but maybe C, D, or even E. My colleague recently joined NIOH in Ahmedabad as a scientist E in recent time, and they are getting gross salary around 2.2, right? And they have passed only 4 or 5 years back that post graduation. So it's a very good opportunity. And the mode of appointment is only interview, your experience, and sometimes they take a MCQ exam. But your personality, your overall attitude may be considered. But it is very good opportunity, and there are multiple institutes are there in India which are ICMR affiliated. So there are very much opportunity for us. And what we need to do in the ICMR? So we are appointed as from scientist B to C or D or E, and ultimately we can reach to G with the experience and with our performance. What we need to do is we have to work as a scientist. So we need to do some good research. We need to collaborate with the national interest agency. We need to publish our research work. We need to work on a patent making, all that, but on the domain of public health or occupational health or whatever the ICMR institute it is, right? And we need to also be working as a training person also, because we need to conduct so much training for our supporting staffs also. So these kind of things are to be done at scientist level at the ICMR. What are the ICMR institutes in India? These are the list of ICMR institutes. There are around 26 institutes which are either ICMR supported or affiliated. So there are ample opportunities for us for working for ICMR, and it's a very easy way to enter in the ICMR if you are good in your basics and you are much experience in that direction. After 4 or 5 years of your PG, you can appointed as a scientist D or E, and that is good. It's associate level scale. For example, in recent time, I think 2 or 3 months back, there was a vacancy for different posts in different institutes in the whole country. And if you see, all the preferable specialization was community medicine, PSM, public health. Sometimes medicine also asked, and number of vacancies are 1, 2, 3 in different institutes, and these are all ICMR institutes. Same for other opportunity. There also, if you see, community medicine is everywhere. So there are 11 opportunities there in the New Delhi. This is a very recent advertisement. So I'm just quoting you to make you realize that these are the real opportunities. These are not only the theoretical part. These are very recent advertisement in the ICMR website. Same for UNICEF. This is a recent advertisement in Gujarat. DC District Child Service Officer only for MD PSM exclusively, and the starting salary is 1 lakh rupees. Another opportunity in UNICEF is consultant, health policy and planning. They are giving you 1.4, excluding their other allowances, so it's around 1.6 or 1.7. Another post in the one of my colleague performing job as a consultant in the UP, and they are getting 2 lakhs per month. So there are real jobs are there as of now. Government of Gujarat and Government of India also supporting MD PSM as their state program officer or state consultant or consultant for comprehensive primary healthcare. These are all the exclusive jobs for MD community medicine. Whenever we are not available, then they can appoint MPH or other branches. But whenever we are available, we are getting first priority. Occupational health. One of my colleagues is working for the Reliance Industries near the Surat. He's getting around 1.5 lakh per month, and they are asking one supplementary course in addition to MD PSM is certificate course in industrial health that can be acquired after PG in your SRCP as a distance learning course, or you can go for the direct 1 year or 6 month course, and then you can appoint as a factory medical officer or occupational safety officer. So in summary, for the first part, where why we need to choose community medicine, these are the opportunities. What kind of the roles are there to be performed from us. So for having these opportunities, we need to make ourselves equipped in our 3 years of PG. For example, communication skills, data analysis, some basics, biostatistics, epidemiology, national programs, some software related workshop. So these, if you make available to you, then you can be appointed for this all the posts. So I don't think any branch will offer you such different options with some good amount of salary and right from your after PG or 1 or 2 years after PG.